Avoidant personality disorder involves severe social inhibition and sensitivity to rejection. Such feelings of insecurity lead to significant problems with the individual's daily life and functioning. People with AVPD often consider themselves to be socially inept or personally unappealing and avoid social interaction for fear of being ridiculed, humiliated, rejected, or disliked. They often avoid becoming involved with others unless they are certain they will be liked. Childhood emotional neglect and peer group rejection are associated with an increased risk for its development. However, it is possible for AVPD to occur without any notable history of abuse or neglect. Avoidant individuals are preoccupied with their own shortcomings and form relationships with others only if they believe they will not be rejected. They often view themselves with contempt, while showing a decreased ability to identify traits within themselves that are generally considered as positive within their societies. Loss and social rejection are so painful that these individuals will choose to be alone rather than risk trying to connect with others. Some with this disorder fantasize about idealized, accepting, and affectionate relationships because of their desire to belong. They often feel themselves unworthy of the relationships they desire, and shame themselves from ever attempting to begin them. If they do manage to form relationships, it is also common for them to preemptively abandon them out of fear of the relationship failing. Individuals with the disorder tend to describe themselves as uneasy, anxious, lonely, unwanted, and isolated from others. They often choose jobs of isolation in which they do not have to interact with others regularly. Avoidant individuals also avoid performing activities in public spaces for fear of embarrassing themselves in front of others. Symptoms include extreme shyness or anxiety in social situations, though the person feels a strong desire for close relationships. Causes of AVPD are not clearly defined, but appear to be influenced by a combination of social, genetic, and psychological factors. Childhood emotional neglect and peer group rejection are both associated with an increased risk for the development of AVPD. Treatment of avoidant personality disorder can employ various techniques, such as social skills training, psychotherapy, cognitive therapy, and exposure treatment to gradually increase social contacts, group therapy for practicing social skills, and sometimes drug therapy. A key issue in treatment is gaining and keeping the patient's trust, since people with an avoidant personality disorder will often start to avoid treatment sessions if they distrust the therapist or fear rejection. The primary purpose of both individual therapy and social skills group training is for individuals with an avoidant personality disorder to begin challenging their exaggerated negative beliefs about themselves. Remember, be yourself, don't seek for attentions. Work hard secretly, so that attention will come to you.